Right now, as you're watching this video, your heart might be sending you desperate warning signals, and you're dismissing them. You're calling them just getting older. You're looking around at your friends who can't climb stairs anymore, who need 3 naps a day, who can't remember where they put their keys 5 minutes ago, and you're thinking, well, everyone my age is like this. This must be normal. And that's exactly what the healthcare system wants you to think, because here's the truth that nobody in the medical industrial complex wants you to know. Those normal aging signs that everyone accepts, they're not normal. They're early warnings of heart failure. And the reason your doctor isn't telling you this is because treating heart failure is a $50 billion industry. Preventive cardiology? That makes them nothing. I am Dr. Michael Kim, board-certified cardiac surgeon. I've spent 23 years repairing hearts that should never have failed in the first place. And I'm tired of watching people dismiss deadly warning signs because some cardiologist told them, "You're just getting older. Take these pills and learn to live with it." The tragic truth is that by the time most people get diagnosed with heart failure, they've been walking around with obvious symptoms for 7 to 10 years. Their body has been screaming at them, and they've been trained to ignore it. Think about that. A full decade of warning signs, dismissed as normal aging. I see patients in my clinic every single week, people in their 50s and 60s, and they tell me stories that break my heart. I thought I was just out of shape. I figured everyone gets tired at my age. My doctor said it was just stress. And then I run the tests, and their ejection fraction, that's the measurement of how well their heart pumps blood, is sitting at 35%. Normal is 50 to 70%. They're in heart failure, and nobody caught it. Why? Because the signs of early heart failure look identical to what we've been culturally conditioned to accept as getting old. And here's what makes me furious. This isn't inevitable. Heart failure isn't some genetic sentence you can't escape. It's the result of specific, identifiable, preventable factors that compound over years. And if you catch them early, not at stage 4 when you're drowning in your own fluid, but early in your 40s and 50s when you first start noticing these signs, you can stop it cold. But the healthcare system doesn't profit from prevention. They profit from management, from lifelong medication regimens, from hospital readmissions, from surgical interventions that cost $150,000. So in this video, I'm going to show you the 10 aging signs that aren't aging at all. They're cardiac decline. And I'm going to explain exactly what's happening inside your body when you experience each one, why your doctor probably won't connect the dots, and what you can do right now, today, to reverse the progression before you end up in the operating room with your chest cracked open and your family praying in the waiting room. This information should be free. It should be taught in every doctor's office, but it's not, because there's no money in keeping you healthy. If you believe that life-saving medical information shouldn't be locked behind a paywall or hidden by an industry that profits from your decline, drop a comment right now saying, "I deserve the truth," and subscribe now. Only the pharmaceutical executives, the hospital administrators, and the doctors who get kickbacks from keeping you sick won't comment, because they know that an educated patient is an unprofitable patient. And before we dive in, I need to say this. I'm a physician, but I'm not your physician. Talk to your doctor before making any changes. Though I'll warn you, most of them won't tell you what I'm about to share. Not because they're bad people, but because they've been trained in a system that treats symptoms, not causes. Every claim I make is backed by peer-reviewed research. Every mechanism I explain is documented in medical literature. The references are in the description. Because unlike the fear-mongering supplement industry that wants you confused and desperate, I want you informed and empowered. Before we get into the specific signs, you need to understand something that the medical establishment doesn't want you to know. There's a massive difference between healthy aging and pathological cardiac decline, but they've been deliberately blurred together. Here's why. When you go to your doctor at 55 and say, "I'm exhausted all the time. I can't think straight. I'm out of breath walking upstairs," What does your doctor say? You're getting older. That's normal. Here's a prescription for your blood pressure. Come back in 6 months. They've been trained to normalize decline. Not because they're evil people, most doctors genuinely want to help, but because the system they work in doesn't reimburse prevention. Insurance companies don't pay for the hour-long consultation it would take to explain metabolic health, cardiac function, and lifestyle intervention. They pay for 7-minute appointments and prescription pads. So your doctor gives you what the system incentivizes: medication management. Meanwhile, your heart is slowly losing its ability to function. And because everyone around you is declining at the same rate, because we're all eating the same inflammatory processed foods, sitting at desks for 8 hours a day, stressed out of our minds, and told that this is just modern life. You think it's normal. It's not normal. It's ubiquitous. There's a difference. Here's what actually happens to a healthy aging heart. Yes, there are some normal changes. After age 60, you might lose about 10% of your maximum cardiac output. Your arteries become slightly less elastic. Your heart rate variability decreases a bit. These are normal aging changes. But here's what's not normal: needing to nap every afternoon, forgetting conversations you had yesterday, not being able to walk a mile without gasping for air, waking up 5 times a night, having to stack 3 pillows just to breathe while sleeping, watching your belly swell up like you're pregnant when you're a 60-year-old man. Those aren't aging. Those are pathology. Those are signs that your heart is failing to pump blood effectively, that fluid is backing up into your tissues, that your brain isn't getting enough oxygen, that your kidneys are being starved of blood flow. But because it happens slowly, over 5, 7, 10 years, you don't notice the progression. It's like gaining 50 pounds. You don't wake up one day shocked that you're obese. It crept up on you, 1 pound at a time, until suddenly you can't tie your shoes without gasping for air. Cardiac decline works the same way. And here's the insidious part. By the time these symptoms become severe enough that you can't ignore them anymore, your heart has already lost 40 to 50% of its pumping capacity. You're past the point of easy intervention. Now you need medications. Now you need procedures. Now you're a profitable patient. The time to act is when the symptoms are subtle. When you first notice you're a little more tired than you used to be. When stairs become slightly harder. When your brain feels foggy by 3 p.m., that's when your heart still has reserve capacity. That's when lifestyle interventions can completely reverse the trajectory. But nobody tells you this. Your doctor doesn't have time. The supplement industry wants you buying their pills instead of understanding root causes. And the pharmaceutical companies certainly aren't going to fund education that would reduce medication use. So here's what I'm going to do. I'm going to walk you through 10 specific signs, explain the exact cardiac mechanism behind each one, tell you what stage of heart failure it indicates, and give you actionable steps to reverse it. Because you deserve to know that your shortness of breath isn't just aging. It's pulmonary edema from left ventricular failure, and it's fixable if you catch it now. Let's start with the signs. Sign 1. You can't keep up with your own life anymore. You used to have energy all day. Now, by 2 p.m., you're fantasizing about crawling into bed. You need coffee just to function. You're canceling plans because you just don't have the energy. You tell yourself you're just busy. You're just stressed. You're just getting older. No, your heart is failing. Here's what's actually happening. Your left ventricle, the main pumping chamber of your heart, is losing its ability to push blood out to your body effectively. This is called reduced cardiac output. And when your tissues aren't getting adequate blood flow, they're not getting adequate oxygen. And without oxygen, your cells can't produce energy efficiently. You know what that feels like? Fatigue. Not the "I had a long day" fatigue. The "I can barely get off the couch to make dinner" fatigue. The "I need a nap after taking a shower" fatigue. And here's why your doctor misses this. They're not looking for it. They test your thyroid, they check your vitamin D, they might screen for depression. all important things. But they're not thinking this 47-year-old with crushing fatigue might have early left ventricular dysfunction. Because fatigue doesn't look like a heart problem. It looks like stress. It looks like aging. It looks like life. But here's the pattern that should terrify you. Does your energy crash every single afternoon, no matter how much sleep you got the night before? Do you feel exhausted even after doing nothing all day? Does climbing one flight of stairs leave you winded and needing to sit down? That's not normal. That's decreased cardiac output, leading to cellular hypoxia. Your tissues are starving for oxygen. This is an early to mid-stage sign. You still have time. Your heart still has reserve capacity. But if you keep ignoring it, keep pushing through with coffee and telling yourself you just need to exercise more or stress less, you're going to wake up in 5 years with full-blown congestive heart failure. And at that point, we're talking about medications for life, possible surgical intervention, and a dramatically reduced lifespan. Or you could address it now, while it's still reversible, while your heart can still recover its strength. But first, you need to recognize that your fatigue isn't character weakness. It's cardiac insufficiency. Sign 2. Your sleep has become fragmented and progressively worse. You're in bed for 8 hours, but you wake up exhausted. You're waking up multiple times throughout the night, not just to urinate, but just waking up. Feeling vaguely anxious or uncomfortable. You've started sleeping with 2 or 3 pillows propped up, because it just feels better. You can't even remember the last time you woke up feeling rested. And your doctor says, that's normal aging. Maybe try melatonin. No. What you're experiencing is orthopnea and paroxysmal nocturnal dyspnea. Those are the medical terms for you can't breathe properly when you lie flat because your heart isn't pumping effectively and fluid is backing up into your lungs. Here's the mechanism. When you lie flat, gravity is no longer pulling fluid down into your legs. That fluid redistributes throughout your body, including into your chest cavity. If your right heart is failing, meaning it's not effectively pumping blood from your body back through your lungs, that fluid starts accumulating in your lungs. And you know what happens when your lungs start filling with fluid? You can't breathe. You wake up gasping. You prop yourself up on pillows because being upright helps the fluid drain downward through gravity. This is why so many people with undiagnosed heart failure end up sleeping in recliners. They don't realize they have heart failure. They just know they sleep better sitting up. And here's what's tragic. By the time you're sleeping in a chair, you're already in mid to late stage heart failure. But the warning signs started years earlier. The fragmented sleep, the vague discomfort lying flat, the need for an extra pillow. Your body was screaming at you. And you dismissed it as insomnia or stress or just getting old. Meanwhile, your right ventricle is struggling to pump blood through your pulmonary system. Pressure is building in your venous system, and fluid is accumulating in your tissues. Here's a simple test. Lie completely flat on your back with one pillow. Can you comfortably breathe like that for 10 minutes? Or do you feel an immediate urge to prop yourself up? If you need elevation to breathe comfortably, that's a red flag. This isn't about comfort. This is about fluid mechanics. And if your heart can't handle you lying flat, it's not functioning properly. And the longer you ignore it, the worse it gets. Sign 3. Brain fog that progressively worsens. Each year, you walk into a room and forget why you went there. You lose your train of thought mid-sentence. You can't remember the name of your neighbor's dog, even though you've known that dog for 5 years. You find yourself searching for simple words, and everyone around you laughs it off. Welcome to getting older. No, your brain is being starved of oxygen. Here's what nobody tells you. Your brain uses 20% of your body's oxygen supply, despite being only 2% of your body weight. It's metabolically expensive to run a human brain, and it requires consistent, adequate blood flow to function properly. When your cardiac output drops, when your heart isn't pumping enough oxygenated blood to your tissues, your brain is one of the first organs to show symptoms. Not with dramatic strokes or obvious neurological deficits, but with subtle cognitive decline. You can't concentrate as well. Your processing speed slows down. Your memory becomes unreliable. You get afternoon crashes, where your thinking becomes foggy and unclear. And your doctor runs basic cognitive tests, maybe orders an MRI, tells you there's no sign of dementia, and sends you home with reassurance that this is normal aging. But it's not dementia. It's chronic cerebral hypoxia. Your brain literally isn't getting enough oxygen to function optimally. And the cause isn't a brain problem, it's a heart problem. This is typically an early to mid-stage sign. Your heart is still pumping, just not efficiently. Your brain is getting enough oxygen to prevent a stroke, but not enough to maintain optimal cognitive function. And it's tricky because it happens gradually, and you adapt. You start writing more notes. You laugh off your forgetfulness. You blame stress. You tell yourself everyone your age is like this. But they're not. Or at least, they shouldn't be. A healthy 60-year-old should have excellent cognitive function. Sharp memory, clear thinking, sustained focus. If you're experiencing progressive cognitive decline in your 50s and 60s, especially if it comes with fatigue and exercise intolerance, you need to have your cardiac function evaluated, not just an EKG, a full echocardiogram measuring ejection fraction and cardiac output. Because your brain fog isn't a brain problem, it's a heart problem, and it's treatable if you catch it early. Sign 4. Digestive issues that appeared out of nowhere. You've started having digestive problems you never had before. You're bloated constantly. You feel full after eating just a few bites. You have nausea that comes and goes without explanation. Maybe you've developed new food sensitivities that never bothered you before, and your doctor refers you to a gastroenterologist who runs tests, finds nothing dramatically wrong, and diagnoses you with functional dyspepsia or irritable bowel syndrome, prescribes you antacids or probiotics, and sends you on your way. But here's what they missed. Your digestive system isn't the problem, your heart is. When your right heart fails to pump effectively, blood backs up in your venous system. And one of the places that blood backs up is in your splanchnic circulation. That's the blood vessels supplying your liver, intestines, stomach, and spleen. This creates what's called splanchnic congestion. Basically, your digestive organs are engorged with blood that can't flow forward properly. This increases pressure in those organs. And that pressure causes symptoms. Your liver swells, your intestines become boggy and inflamed, your stomach can't empty properly. You develop something called early satiety, where you feel uncomfortably full after eating just a small amount, because your stomach is literally being compressed by fluid pressure. In more advanced cases, that pressure causes fluid to leak out of your blood vessels into your abdominal cavity. This is called ascites. Your belly swells up. You look pregnant, and people assume you've just gained weight. But it's not weight. It's liters of fluid that your failing heart can't properly circulate. Now, this is typically a mid to late stage sign. By the time you have ascites, your heart failure is advanced. But the earlier digestive symptoms, the bloating, the early satiety, the unexplained nausea, those can show up much earlier, and they're almost never recognized as cardiac symptoms because they seem completely unrelated to your heart. But they're not unrelated. Your entire circulatory system is connected. When your heart fails, everything downstream suffers, including your gut. So if you've developed new, unexplained digestive issues, especially if they're accompanied by other signs on this list, you need cardiac evaluation, not just more antacids. Because your digestive system might be completely healthy, it's just being choked by a failing circulatory system. Sign 5. Cold extremities and poor temperature regulation. Your hands and feet are always cold. You wear socks to bed even in summer. You layer up while everyone around you is comfortable. You've started getting night sweats that alternate with feeling freezing cold. And you tell yourself you just run cold, or you're going through hormonal changes. Wrong. Your peripheral circulation is failing. Here's the physiology. When your cardiac output drops, your body has to make choices about where to send the limited blood flow it has available. And your body is smart. It prioritizes your vital organs, your brain, your heart, your lungs, your kidneys. What gets sacrificed? Your extremities, your hands, your feet, your skin. Your body constricts the blood vessels in your peripheral circulation to shunt more blood to your core organs. This is called peripheral vasoconstriction, and it's a compensatory mechanism for reduced cardiac output. So your hands and feet aren't getting adequate blood flow. They're cold. They might turn pale or even slightly blue. You might develop something that looks like Raynaud's phenomenon, where your fingers turn white or blue in response to cold or stress. But it's not Raynaud's. It's cardiac insufficiency. And the temperature dysregulation, the alternating between freezing cold and night sweats, that's your autonomic nervous system going haywire, trying to compensate for poor circulation. Your body is literally in survival mode, constantly adjusting blood flow and temperature regulation to keep your vital organs functioning. And that creates these wild swings in how you feel. This is typically an early to mid-stage sign. Your heart is still pumping enough to keep you alive, but not enough to maintain comfortable peripheral perfusion. And here's what makes this particularly dangerous. Most people dismiss this symptom entirely. They buy warmer socks, they turn up the heat, they blame menopause or thyroid issues. And yes, thyroid problems can cause cold intolerance. But if you have cold extremities plus fatigue, plus shortness of breath, plus cognitive changes, you're looking at a pattern of reduced cardiac output, not a thyroid problem. Test yourself. Sit in a comfortable room temperature. Are your hands and feet noticeably colder than the rest of your body? Do you need gloves or thick socks just to feel normal? That's not a thermostat problem. That's a circulation problem. And circulation problems start with the heart. Sign 6. Persistent dry cough or throat clearing. You've developed a persistent cough that won't go away. It's not productive. You're not coughing up much of anything. But it's constant, especially at night. You're always clearing your throat. Your doctor thinks it might be allergies or acid reflux. You've tried allergy medications, you've tried antacids, nothing helps. Because it's not allergies, it's not reflux. It's fluid in your lungs. Here's what's happening. When your left ventricle can't pump blood effectively out to your body, that blood backs up into your left atrium. And where does blood come into your left atrium from? Your lungs. So now you have increased pressure backing up into your pulmonary veins. This is called pulmonary venous congestion. And when there's too much pressure in those vessels, fluid starts leaking out into your lung tissue. Not enough to drown you, not yet, but enough to irritate your airways. That irritation triggers a cough reflex. Your body is trying to clear something that can't be cleared by coughing because it's not in your airways. It's in your lung tissue itself. This is also why the cough is worse when you lie down. Gravity. When you're upright, fluid tends to settle in the lower portions of your lungs. When you lie flat, it redistributes more evenly throughout your lung tissue, increasing the irritation. Some people develop a more productive cough, where they're bringing up frothy, sometimes blood-tinged sputum. That's because the fluid in their lungs is mixing with air and getting coughed up. That's called hemoptysis, and it's a sign of more advanced pulmonary edema. But long before you get to that point, you have this annoying dry cough, this persistent throat clearing. This feeling like you can't quite take a full deep breath. And everyone, including your doctor, treats it like a respiratory problem. They give you inhalers. They prescribe cough suppressants. They send you to an allergist. But it's not a respiratory problem. It's a cardiac problem causing respiratory symptoms. This is typically a mid-stage sign. Your left heart is failing enough to cause pulmonary congestion, but not so severely that you're in acute pulmonary edema yet. But you're headed there if you don't address the underlying cardiac dysfunction. That cough is your lungs literally drowning. Slowly. And everyone is treating the symptom while ignoring the cause. Sign 7. Reduced exercise tolerance. Despite staying active. You've always been active. You've been walking the same route, doing the same workouts for years. But suddenly, that routine that used to feel easy is becoming difficult. Your heart rate shoots up. You're out of breath. You need longer recovery times. And you think, I guess I'm just out of shape. I need to push harder. No, you need to stop and evaluate your cardiac function. Because what you're experiencing is called reduced exercise tolerance. And it's one of the earliest measurable signs of cardiac dysfunction. Here's why this matters. When you exercise, your muscles demand more oxygen. Your heart has to pump more blood to deliver that oxygen. A healthy heart has reserve capacity. It can increase its output by 5 to 7 times during exercise. But a failing heart can't. It's already working at near maximum capacity just to meet your resting needs. So, when you try to exercise, your heart can't keep up with the demand. Your muscles don't get enough oxygen. You fatigue rapidly. Your heart rate spikes, trying to compensate by beating faster. But because your stroke volume, the amount of blood pumped per beat, is reduced, a faster heart rate doesn't help much. And you know what that feels like? Like you're suddenly out of shape, despite maintaining the same activity level. This is an early stage sign, and it's one of the most important ones because it's measurable. If you track your heart rate during a standard workout and notice it's significantly higher than it used to be for the same level of effort, that's a red flag. If your recovery heart rate, how long it takes your heart rate to return to baseline after exercise, is getting slower, that's a red flag. If you need to take breaks during activities that used to be easy, that's a red flag. And here's what's tragic. Most people respond to reduced exercise tolerance by pushing harder. They think they're just being lazy. So they force themselves through workouts that their heart can't support, which further stresses an already failing system. The correct response to unexplained reduced exercise tolerance isn't to push harder. It's to get your cardiac function evaluated, because your body is telling you something is wrong. And in this case, what's wrong is that your heart is losing its ability to do its job. Sign 8. Unexplained anxiety or mood changes. You've never been an anxious person, but suddenly you're experiencing persistent, low-level anxiety, or maybe outright panic attacks that seem to come out of nowhere. You feel restless, on edge, like something terrible is about to happen. You might be experiencing depression that doesn't respond to normal treatments. Your doctor prescribes an SSRI and refers you to therapy. But here's what they're missing. Your anxiety might be a cardiovascular symptom. When your heart isn't pumping effectively, your body knows something is wrong. Your sympathetic nervous system, your fight or flight system, activates to compensate. It releases stress hormones like adrenaline and cortisol to try to boost your cardiac output and blood pressure. And you know what high levels of adrenaline and cortisol feel like? Anxiety, restlessness, that impending sense of doom. It's not psychological, it's physiological. Your body is in a state of chronic stress because your heart is failing, and your autonomic nervous system is desperately trying to compensate. Additionally, if your brain isn't getting adequate oxygen due to reduced cardiac output, that can manifest as depression, apathy, and mood changes. Your brain needs oxygen to produce neurotransmitters like serotonin and dopamine. Without adequate oxygenation, your neurochemistry gets disrupted, so you end up with anxiety, depression, or both. And because these are psychiatric symptoms, everyone treats them psychiatrically. You get therapy. You get medications. You're told to meditate and practice mindfulness. And those things might help manage the symptoms. But they're not addressing the underlying cause, your failing heart. This can be an early to late stage sign depending on the mechanism. Early stage heart failure can trigger anxiety through sympathetic activation. Late stage heart failure can cause depression through chronic hypoxia. And here's what makes this particularly insidious. Psychiatric symptoms are so common that they're easy to dismiss as unrelated to physical health. Everyone has anxiety. Everyone gets depressed sometimes. But if your anxiety or depression came on suddenly, especially if it's accompanied by physical symptoms like fatigue, shortness of breath, or exercise intolerance, you need cardiac evaluation, because your mental health problem might actually be a heart problem. And treating it with antidepressants alone is like putting a Band-Aid on a severed artery. You're managing the symptom while the underlying pathology progresses unchecked. Sign 9. Swelling. That comes and goes. You notice your rings are tight some days, but not others. Your shoes feel snug by evening, but fine in the morning. You have puffiness in your face when you wake up. Your ankles swell by the end of the day, and you think, I must have eaten too much salt, or I've been standing too long. No, you have intermittent fluid retention. And that's a sign that your kidneys are responding to reduced cardiac output by retaining salt and water. Here's the mechanism. When your left ventricle can't pump blood effectively, your kidneys receive less blood flow. Your kidneys interpret this as dehydration. They don't know the difference between not enough blood volume and the blood volume isn't being pumped effectively. So they activate the renin-angiotensin-aldosterone system. This is a hormonal cascade designed to retain salt and water to increase blood volume. Your kidneys start holding on to sodium, and where sodium goes, water follows. Result, you start retaining fluid, pounds of fluid. 2, 3, 5 pounds of water weight that appears seemingly overnight. And because your heart still can't pump effectively, that extra fluid doesn't help. It just accumulates in your tissues. Your ankles swell, your belly swells, your face gets puffy. This is called dependent edema because it accumulates in whatever body parts are lowest due to gravity. During the day when you're upright, it pools in your legs and ankles. At night when you lie down, it redistributes to your face and trunk. This is typically a mid-stage sign. Your kidneys are actively compensating for reduced cardiac output. Your right heart is starting to fail, unable to handle the increased fluid volume and unable to pump it effectively back through your lungs. Here's a simple test. Press your thumb into your shin bone for 10 seconds. When you release, does it leave an indentation that takes a while to bounce back? That's pitting edema. That's not normal. That's fluid in your tissues. Another test, weigh yourself daily at the same time. If you gain 2 or more pounds in 2 days without any change in diet or activity, that's fluid retention. That's a cardiac red flag. Your body is drowning in fluid it can't circulate, and everyone is telling you to just drink less water. Sign 10. Decreased libido and sexual function. Your sex drive has disappeared. You can't achieve or maintain erections if you're male. You have no interest in sex if you're female. And everyone tells you, that's just aging. That's just stress. That's just hormones. And maybe you get your testosterone checked. Maybe your doctor prescribes Viagra. Maybe you try supplements. But here's what they're missing. Sexual function requires adequate blood flow. And if your heart isn't pumping effectively, your genitals aren't getting adequate blood flow. Erectile dysfunction in men is often the first measurable sign of vascular disease. The arteries supplying the penis are smaller than coronary arteries, so they show signs of dysfunction earlier. If you can't get adequate blood flow to achieve an erection, there's a good chance your coronary arteries are also compromised. And for both men and women, libido requires adequate brain function. If your brain isn't getting enough oxygen due to reduced cardiac output, your hormones might be fine, but your brain can't generate desire because it's operating in survival mode. This is typically an early to mid-stage sign. And it's actually one of the earliest signs that something is vascular wrong, which is why erectile dysfunction is considered a predictor of future cardiovascular events. But nobody connects the dots. Men take Viagra, which helps the symptom but doesn't address the underlying vascular dysfunction. Women are told it's hormones or stress or relationship issues. And meanwhile, the heart continues to decline. If you've experienced a significant decrease in sexual function over the past 2 to 5 years, not sudden, but progressive, especially if accompanied by other signs on this list, You need vascular evaluation. Not just a testosterone check, not just a prescription for erectile dysfunction medication, because your sexual dysfunction isn't a sex problem, it's a blood flow problem, and blood flow problems originate with cardiac function. Your decreased libido is your body telling you that it doesn't have adequate circulation to support non-essential functions like reproduction. Your body is in conservation mode, directing blood flow only to organs essential for immediate survival. That's not aging, that's pathology. And it's reversible if you address the cardiac dysfunction before it progresses to heart failure. Have you noticed any of these signs in your body? Subscribe now if you have, type no if you have not. Now that you know the 10 signs, you need to understand why they're appearing together. Because heart failure isn't one disease. It's the end result of multiple factors that converge to destroy cardiac function. And the healthcare system doesn't want you to know this because if you understood the root causes, you'd realize how much control you actually have over this process. So let me tell you what they won't. Your heart doesn't just fail randomly. It fails because of a specific cascade of metabolic dysfunction that starts decades before you experience any symptoms. It begins with chronic inflammation. Every time you eat processed food loaded with seed oils and refined sugars, you trigger an inflammatory response. Every time you sit for 8 hours without moving, you trigger inflammation. Every time you experience chronic stress without recovery, you trigger inflammation. And inflammation damages your endothelium. That's the inner lining of your blood vessels. Damaged endothelium can't regulate blood flow properly. It becomes stiff and dysfunctional. Blood pressure rises. Your heart has to work harder to pump blood through resistant vessels. But the inflammation also triggers something even more insidious: insulin resistance. When your cells are chronically inflamed, they become resistant to insulin's signals. Glucose can't enter your cells efficiently, so your pancreas pumps out more insulin, trying to force glucose into cells. And high insulin levels are directly cardiotoxic. They damage heart muscle cells and promote hypertrophy, where your heart muscle thickens abnormally. Meanwhile, because glucose can't enter cells properly, it stays in your bloodstream longer. That elevated blood glucose glycates proteins, creating advanced glycation end products. Basically, caramelized proteins that are stiff and dysfunctional. This happens in your blood vessel walls. This happens in your heart muscle. Your heart becomes literally stiff, less flexible, unable to pump efficiently. At the same time, insulin resistance triggers your liver to produce more VLDL cholesterol and triglycerides. These particles get oxidized by the chronic inflammation in your system, creating oxidized LDL, the type that actually deposits in your arterial walls and creates atherosclerotic plaques. So now you have multiple problems, like inflamed, damaged blood vessels with rising blood pressure, a heart working overtime, trying to overcome that resistance, insulin-damaged heart muscle, becoming stiff and dysfunctional, oxidized cholesterol, creating blockages in your coronary arteries, and elevated glucose glycating and stiffening your heart tissue. This is the metabolic perfect storm, and it doesn't happen in 6 months. It takes 10, 15, 20 years of accumulated damage. But here's what the healthcare system does. They wait until you're symptomatic. Then they treat each problem in isolation. High blood pressure? Here's a beta blocker. High cholesterol? Here's a statin. Diabetes? Here's metformin. They're giving you 5 different medications to treat 5 different symptoms of the same underlying problem: metabolic dysfunction driven by inflammation and insulin resistance. And none of those medications address the root cause. They just manage the symptoms while the underlying pathology continues to progress. Let me be very specific about the 5 factors that are destroying hearts at epidemic rates. And notice how every single one is influenced by lifestyle, not genetics. Cause 1. Chronic inflammation. The sources are everywhere: processed seed oils, soybean, canola, corn oil, refined sugars, processed grains, chronic stress, lack of sleep, sedentary behavior, environmental toxins, chronic infections. Every single one of these triggers inflammation. And inflammation damages every system in your body, especially your cardiovascular system. To test for chronic inflammation, you can measure with high-sensitivity CRP, homocysteine, and oxidized LDL levels. Eliminate processed foods, increase omega-3 fatty acids, prioritize sleep, manage stress, move regularly. Cause 2. Insulin resistance. This is the master key. Insulin resistance drives hypertension, it drives dyslipidemia, it drives direct cardiac damage, it drives oxidative stress. The American Heart Association published data showing that insulin resistance increases heart failure risk by 60% independent of other risk factors. 60%. And what causes insulin resistance? Chronic consumption of refined carbohydrates and sugars, sedentary lifestyle, poor sleep, chronic stress, obesity, especially visceral fat. Testing. Fasting insulin. Should be under 5. HOMA-IR. Triglyceride to HDL ratio. Reversal. Carbohydrate restriction, intermittent fasting, resistance training, adequate protein, restorative sleep. Cause 3. Oxidative stress. Free radicals damage cellular membranes, DNA, and proteins throughout your body. Your heart muscle cells are particularly vulnerable because they have such high metabolic demands. Sources: processed foods, fried foods, excessive exercise without recovery, environmental toxins, smoking, chronic inflammation. Testing: oxidized LDL, 8-OHDG, urine test for oxidative DNA damage. Reduction: antioxidant-rich foods, berries, leafy greens, colorful vegetables. Eliminate fried foods. Quit smoking, moderate alcohol, support glutathione production. Cause 4. Chronic stress cortisol, your stress hormone, is directly cardiotoxic at chronically elevated levels. It raises blood pressure, promotes insulin resistance, increases inflammation, disrupts sleep, and directly damages heart muscle. The Framingham Heart Study showed that chronic psychological stress increases heart disease risk by 40%. Management: daily stress reduction practices, not just when you're stressed. Preventively: adequate sleep, social connection, purpose and meaning, nervous system regulation. Cause 5. Sedentary lifestyle. Your body is designed to move. Sitting for extended periods reduces circulation, increases inflammation, promotes insulin resistance, weakens muscles, including your heart, and disrupts metabolic function. Research shows that sitting for more than 6 hours daily increases cardiovascular mortality by 40% compared to sitting less than 3 hours, even in people who exercise regularly. The solution isn't go to the gym, it's integrate movement throughout your entire day. Walk, take stairs, stand, move while you work. Your body needs constant low-level activity. All of these factors compound over time. The damage accumulates. Your heart has enormous reserve capacity, so you don't notice symptoms until you've lost 40 to 50% of function. By the time you feel bad, you're already in trouble. That's why catching these signs early, when they're subtle, when everyone tells you they're normal, is so critical. Because once you're in heart failure, reversal is difficult, possible, but difficult. Prevention is exponentially easier than reversal. And that's exactly why the healthcare system doesn't focus on prevention. There's no profit in keeping you healthy. The profit is in lifelong management of chronic disease. So they wait until you're sick enough to need expensive interventions. And then they've got you for life, unless you take control now while you still have time. If you're experiencing any of these signs, here's what you need to do immediately. Not next month, not when you get around to it. Today. First, self-assessment. Go through all 10 signs systematically. How many apply to you? If you have 3 or more, you need medical evaluation urgently. If you have 5 or more, you need to be evaluated this week, not next month. Second, schedule proper testing, not just an EKG. You need an echocardiogram that measures ejection fraction, stroke volume, and wall motion abnormalities. You need a BNP or NT-proBNP blood test. These are markers of heart strain. You need inflammatory markers, high-sensitivity CRP, homocysteine, oxidized LDL. If your doctor dismisses your concerns, find another doctor. Your life is more valuable than preserving a relationship with a physician who won't listen. Third, start tracking. Get a notebook or phone app. Track your weight daily at the same time. Track your symptoms when you feel fatigue, shortness of breath, cognitive fog. Track your exercise tolerance, how far you can walk, how your heart rate responds. This data is critical for monitoring progression or improvement. Eliminate all processed foods, all seed oils, soybean, canola, corn, cottonseed, safflower, sunflower, all refined sugars, all refined grains. Eat primarily fatty fish, salmon, mackerel, sardines, 3 to 4 times weekly, grass-fed beef and lamb, pastured eggs, colorful vegetables, as many as you can eat, leafy greens daily, nuts and seeds, olive oil, avocados, berries. If you must include carbohydrates, it should be only whole food sources. Sweet potatoes, squash, steel-cut oats, quinoa, properly prepared beans. And always with protein and fat to blunt glucose response. Consider a 16.8 intermittent fasting window. Eat your meals within an 8-hour period, preferably finishing eating 3 hours before bed. This gives your heart and entire cardiovascular system time to repair without the metabolic stress of constant digestion. Walk every day. Your goal is 8,000 to 10,000 steps daily, but spread throughout the day, not just a single workout. You can follow this specific protocols. Morning, 10-15-minute walk upon waking. After each meal, 10-minute walk. This is non-negotiable. Evening, 20-30-minute walk before dinner. Throughout the day, stand and move every 30 minutes if you have a desk job. Perform resistance training, twice weekly, full body, focusing on compound movements. This improves insulin sensitivity and builds metabolic reserve. But don't overdo it. Your heart needs recovery time. But chronic stress will sabotage everything else you do, so take 10 minutes of diaphragmatic breathing practice, morning and evening, vagus nerve activation exercises, 7 to 8 hours of sleep in a completely dark, cool room, 1 hour daily completely disconnected from screens and news, and a weekly meaningful social connection with nature. The $50 billion heart failure industry doesn't want you to know that you have more control over your cardiac health than they'll ever admit. Because if you knew that simple lifestyle interventions could reverse early heart failure, you wouldn't be a profitable patient. You wouldn't need lifelong medications. You wouldn't need repeated hospitalizations. You wouldn't need expensive procedures. And that would cost them billions. So they keep you ignorant. They normalize your decline. They tell you that fatigue and brain fog and shortness of breath are just part of getting older. They prescribe you medications that manage symptoms while the underlying pathology progresses. And by the time you realize how serious your condition is, you're dependent on the system. You need them now. And they've got you for life. But you have a choice today. You can dismiss these signs like everyone else does. You can tell yourself you're just getting older. You can wait until you're in full-blown heart failure before you take action. Or you can recognize that your body is screaming at you right now, that your fatigue isn't laziness, that your brain fog isn't inevitable, that your shortness of breath isn't normal. You can take control of the factors destroying your heart before it's too late. Your heart has remarkable capacity to recover if you give it what it needs: real food, consistent movement, adequate rest, and elimination of the toxins destroying it. But you have to act while you still have reserve capacity, while your ejection fraction hasn't dropped below 40%, while you're still in the window where intervention actually works. Because once you cross that line into advanced heart failure, reversal becomes exponentially harder. Still possible, but difficult. Prevention is always easier than reversal. So make your choice. If you believe that life-saving medical information should be free and not gatekept by an industry that profits from your decline, smash that subscribe button right now. Only the pharmaceutical executives, hospital administrators, and corrupt doctors who make money off your suffering won't subscribe. If you refuse to be another profit center for an industry that wants you sick and dependent, drop a comment saying, "I choose prevention." Let them know you see through their scam. And if you have parents, siblings, or friends in their 50s and 60s who are dismissing these exact symptoms as just aging, share this video with them immediately. You might save their life. In my next video, I'm exposing the cholesterol lie that's been bankrupting American seniors for 40 years. The real reason statins are the most prescribed drug in history, despite barely reducing heart attack risk. The pharmaceutical industry is going to hate that one.